Okay, we will start discussing today our lecture about performance improvement. I'm asking about the slide. Is it clear for you?
Yes, it is.
Okay, thank you, Aisha. Okay, today we will talk about performance improvement, and this skill is very important management function that enhance the staff ability, performance ability, and enhance the selection criteria, recruiting criteria, and can develop the skills among our staff. In our lecture today, we will cover the faculty end of program student learning outcome number 2, and we will try to enhance your ability to obtain evidence from scientific article that I shared with you during previous lecture about nurses empowerment as literature review paper. And our specific objectives will be to increase the awareness of students about the methods and techniques involved in nursing, organization, utilization, and development and appraisal process. The learning objectives for our lecture today will about to identify the definition of different concepts in performance improvement as job performance, supervision, performance appraisal, and performance feedback. And we will try to apply the processes of performance assessment in a clinical setting by giving examples, sure, in a clinical area, and to identify and use appropriate performance appraisal tools for measuring professional nursing performance by discussing different tools that will be used during the assessment of performance appraisal in clinical setting. Then we will identify factors that increase the likelihood that performance appraisal will develop and motivate staff, and how to give feedback, even positive or negative. And during our lecture, we will learn how to avoid some error during evaluation as halo error, horn effect error, and center tendency and recency errors during conducting performance appraisal. And our lecture today, we will recognize, by the end of our lecture, we will recognize the subjectivity issue as an ever-present limitation of performance appraisal. And also we will describe the technique of coaching and to differentiate between different performance appraisal tool as rating scale, checklist, essay, and management by objectives tool. Okay, so the main outline in our lecture will be to cover all of these subject: performance improvement in healthcare, selecting staff, developing staff, performance appraisal. We will start by this image. Can any one of you please can do an interpretation for this image, or can anyone can answer, please?
Yes. May I answer?
Yeah, sure, Aisha, please.
I would like to say that self-esteem is, we can say that's how person feel about themselves.
Yeah.
And self-image is how person see themselves and how they believe others see them.
So this picture or this image, maybe you took this picture previously in psychiatric course about self-image, self-esteem, self-confidence, or self-concept. How can I see myself? How others can see me? And is the image the same between how can I see myself and the others see me? So here we are talking about self-appraisal, how I can see myself, and peer appraisal, others appraisal. And it's very important to do balance between how I can see myself in the mirror and how others see me. By the end of this, the conclusion of these images is we will talk in this lecture about underestimating ourselves. We can, for example, if here instead of cat there is a lion, and the lion see himself like cat at the opposite of this picture, we call it under evaluation or underestimating our abilities, and we don't have trust and confidence for our abilities. But the opposite here is the overestimating of evaluation, when the cat look for itself on the mirror and see itself like lion. Here what happened in management and performance, we call it overestimating or over evaluation. and both of them are biased in evaluation. So what's your shadow? How your shadow is reflected by yourself and by others is very important to do balance and to compare between them to find the differences in those issues. Who can define the job performance?
Can I?
Who are you?
Islam.
Yeah, Islam, sure, تفضلي.
Staff abilities and motivation to do the job description and follow organization policy and regulation.
So the job performance reflects
Ability, what I can do.
Yeah, abilities and motivation to perform the job description following the organizational policies and regulation. Also, we have repeated here again, the presence of motivation is very important in job performance. I have abilities and motivation to perform what is required from me in job description, okay? Okay, in performance improvement, we will talk about different tasks or skills. For example, selecting staff, developing staff, evaluating staff. And those are our dimension for our lecture today. Now, we will start by selecting staff. Anyone can talk about his or her experience about selection criteria. I know that most of you are bridging students. Can you inform us about how you are selected and hired in the hospital? Talk about your personal scenario. You can speak in Arabic and I will translate if it is difficult to express. I'm waiting answer, please.
Doctor, can you repeat the question, please?
Yes, for bridging students, when you hired in the hospital, Islam or anyone, what is the process of selection? Do you remember how the hospital
yes,
hired you?
The certification.
Okay, they ask about your certification also.
Experience.
So they check about your experiences. What else?
They make a specific exam to measure your abilities.
So you did exam, and the exam could be written exam or oral exam. So sometimes they perform interview with the selected employee or during the recruitment process with suggested employee to do the process of hiring before the decision of hiring or appointment. Okay, so selecting staff is the process of selection the most qualified individual. For example, when I announce for hiring or job opportunities in the hospital as registered nurse or practical nurse, the number of the suggested employee will be, for example, 10, and I have to select only 2 or 3 or 3 of them. So I have to check the most qualified individual from the nominee personnel who will attend during the interview. How that will occur? Firstly, in the selection criteria, we have to start what we call recruitment process. In recruitment process, there is an announcement. Sometimes the announcement or advertisement could be announced during the social media, could be announced during the journal, newspaper, the website of the hospital. After that announcement occurs, during the announcement should include the criteria or the requirement. For example, registered nurses for emergency with experience of 2 years working in emergency, BLS, advanced cardiac life support are required, for example. So I put during the announcement the conditions and the requirements for this position. After the recruitment process, I have to make a decision of selection and then hiring. Based on that, we have to confirm the concepts of the desirable outcomes. During the interview with the personnel, during the selection process, I have mentioned the outcomes and the objectives of my hospital, and also the suggested employee should inform our desirable outcomes, and the balance and the agreement for both employer and employee should be for these outcomes. After that, the selection criteria will occur. The selection could be from internal staff or external. What's that mean? When the process of selection for new position could be from internal staff.
4 months مثلا.
Internal staff. How can we do hiring the employee for a new position, but internal staff, not from external staff?
May I answer?
Yeah, sure.
I think that internal, maybe in the same organization.
Okay, how?
If I have multiple nurses,
okay,
and I have a job for a head nurse,
okay,
I can choose from the nurses that I have in the organization.
Yeah.
So they can take the job.
Yeah, excellent, excellent. That's what happened when I do selection by from internal staff. When we have, for example, a new position or a new opportunity for head nurse, and already the current head nurse will resign or will think to quit the job, I have a replacement from my available staff in ICU, for example, and I have to select from internal. That's what we call a promotion from registered nurse to head nurse. And how to do selection criteria also, they have specific criteria for internal and external staff. Okay, this criteria includes, for example, experiences, as Islam said, also certificate level, leadership and management skills, for example, and the management by objectives. And all of these issues will be clarified by CV, curriculum vitae, and after that, the decision will be made. After hiring process, I think most of you know that we have, according to our laws and regulation, we have 3 months of testing, and in this time or this duration, both parties, employer and employee, can make a decision to continue or to stop the work with
or
this.
Discontinue.
Yeah, or to discontinue. According to our labor laws, we have 3 months after hiring the process to make a decision for continue or discontinue according to the performance appraisal decision. Okay? Okay, so the first thing in performance improvement is selection. The second thing is orientation. In orientation program, already, who attended orientation program previously during your experience?
Director of nursing.
I'm asking about who's from you as attended an orientation program
the
in
new
hospital.
staff.
Yes, the new staff.
And the new graduate.
Do you attend Islam orientation program in the hospital?
1 week.
1 week. Is there anyone else rather than Islam can talk about the orientation program, please? Who attended orientation program in the hospital when you hired as practical nurse? There's no one? Okay, you can talk in Arabic. مين حضر برنامج orientation، برنامج التعريفي لما داومتوا؟
Doctor, can we say the head nurse?
Natalie, yes.
Can we say the head nurse? She's the one who do the orientation program.
Yes. The head nurse is the person who performed the orientation. He involved in doing orientation. But for whom? I'm asking, who is attending the orientation? For whom is making the orientation program?
For example, we can say she can make it for a new nurse.
For new nurses, yes. And also for nurses who transferred, for example, from department to other department, they have to attend also an orientation program. Okay, Islam, can you talk about the orientation program that you attended during your hiring process?
Yes. يعني كانت إنه لفة على كل الأقسام مثلا around all department.
Okay.
Okay, and about documentation.
Okay.
Infection control.
So they give you lecture about documentation process.
Yes.
Infection control. What else?
HR.
Human resources, for example, annual leaves, sick leaves, your salary, for example. So they perform orientation program. Specifically, the orientation program should focus on main issues like safety programs, as Islam said, infection control, and work environment admission. How is the policies, procedure, environmental condition of the hospital, and
doctor.
And what?
And how use specific equipments or machines.
Yes, how use equipments, machine, policies, procedure, communication, for example, medication administration, how you can, maybe they can review a course about medication administration, medication calculation, especially for novice nurses and newly graduate nurses, may do some lecture related to this issue. And also they can perform human resources session, talking about a strategic plan of the hospital, mission, vision, values of the hospital, objectives of the hospitals to be congruent with what is desired for the employee. Okay, all are these issues or topics are covered during the orientation program at the beginning of hiring process. After 3 months, the performance appraisal and evaluation must be okay for this employee, and the decision is to continue or to give further development for this employee. Okay, we have also during the orientation what we call preceptor or mentorship. In preceptorship, can anyone tell me what is the preceptorship? Who is the preceptor?
May I answer?
Yes, please.
اللي بتابع الصف الجديد دكتورة.
Yes, please, Muhammad. Sorry, Aisha. Muhammad, can you answer, please?
اللي بتابع الصف الجديد اللي هو البريسبتور.
Yes. The preceptor, not only for new nurses, it could be hired also or appointed for other nurses in hospital. The preceptor, the person who is asked or responsible and accountable to follow up, supervise, coach the new nurses in the hospital. Okay, and also mentorship. We will talk about this skill now during our lecture. Aisha, if you want to add anything?
No, the same thing that he said.
Okay, thank you. During the staff development, we have to do continuing education program, continued development program, professional socialization and development. Empowerment strategies is one of main strategies to develop the skills of our nurses in hospital. We can do open environment, freedom to make accountable decision, timely positive feedback, achievement, recognition, coaching, shared governance. To cover the empowerment, we will discuss an article related to empowerment among nurses as a literature review. I will share it now with all of you to mention some strategies for empowerment among nurses. Okay, this is our article to be discussed today. Is it clear for you?
Yes, doctor.
Okay, Natalie, thank you. Okay, the title of our lecture is Work-Related Empowerment Among Nurses. It is a literature review. Literature review is is a summary of the previous article's findings related to specific topic, which is now here about work-related empowerment among nurses. And this article is conducted by me, Dr. Layla, Dr. Hannah, and Dr. Muayyad Ahmad from University of Jordan. Basically, this article discussed answered three questions. What is the meaning of empowerment? The nurses of empowerment. How were nurses empowered? What are the factors connected with nurses empowerment? And what is the impact of empowerment on nurses and healthcare outcomes? During this article, we discussed the factors contributing empowerment among nurses. For example, now I will let you to read what I highlighted in this article to know here. For example, who can read the highlighted lines here? Note that we are talking now about factor contributing nurses empowerment, promoting or impeding factors. And we will discuss the nurses from different sides. For example, nurses in a clinical area, nurses as a student, and nurses as educator. And we will mention in this article certain strategies to enhance all types of those groups, okay? Who can read here?
Yes.
Now we will talk
May I?
about nurses in a clinical setting. Natalie,
Can
can you
I?
read, please? Natalie, can you read this paragraph, please? Okay, who can?
Can I?
Yeah.
Can I?
Yes, Aisha, then Islam.
Okay.
I'm sorry, the internet is not very good. I can read it, yes.
Okay, Natalie, thank you. Then Aisha, then Islam, okay?
Okay, you want me to read or who?
Yeah, please, Natalie.
Okay. 1 minute.
Here, from this.
دكتورة راحت من عندي دقيقة بس.
Okay, no problem.
Okay. Okay, nursing motivation for professional improvement, work time and work independence, related factors, teamwork and training continuous, improvement programs, efforts for top management, commitment, organizational justice and healthcare receptance, satisfaction are significantly factors empowering employees.
Thank you, Natalie. Here we are talking about strategies that enhance nurses during their clinical area. So here we are talking about the clinical nurses and the motivation factors related to them. For example, they are talking about working time. Working time, for example, some of them say that 12 hours per day is difficult to them. Maybe 3 shifts is better to them to be more empowered. And work independence related, for example, autonomy, teamwork, training, continuous improvement process, efforts from top management's commitment, organizational justice and fairness, and health recipient satisfaction are significantly factors empowering employees. So those are issues related to clinical nurses. Also, in addition here, they talked about working time as important factor. Nurses who work during nighttime displayed less empowered than others. And also, I think that you have the same experience when you work in C shift or a night shift. It's more difficult to you, and you feel that you are less empowered than the nurses who are working on day shift or on A shifts. Is it true? Do you feel that?
Yes.
Nurses who are working at night shift is less empowered than nurses who are working at day shift.
Of course, doctor. Of course.
Yes, of course.
Okay.
Less load.
Less load. Less load. In which shift?
I mean workload.
Workload.
Less
Yes.
And less environment.
Less stress. Also, we can say.
Okay. Okay. What else here? Nursing empowerment here about nursing student like you. What are the factors that make you as a student to be empowered, and what are the factors that decrease your empowerment level? Who can read this paragraph, please?
I can read.
Yes,
I can
Aisha,
read if
please.
you want. Okay. Nursing students during their clinical practice time are not less important than actual bedside nurses. To be considered for factors influencing their empowerment, the level of competence and basic knowledge, which responds the core, represent the core of the anesthetic factors among.
Intrinsic
Yeah, the word
factors.
is not really
Ah, yes, don't worry.
Okay, nursing student is um,
Is crucial.
I cannot see the word crucial to influence.
They are not so clear, to be honest,
Yes,
Doctor.
their own empowerment. Many others external influences were also identified, including nursing student sense of value as learner,
Learner.
effective, and continuous
Mentorship.
mentorship, clear nursing policy, and manipulation of
Manipulation of
yes
organizational structure
structure to save nurse student need
to
during their
satisfy,
clinical
nursing students need during their clinical practice.
as
Yes,
well as their own empowerment from their first year to last year to be of their study.
yes, excellent. Here in this paragraph, the previous literature talked about the factors increase the empowerment level among nursing students. Basically, they were talking about the knowledge, they are talking about the clear nursing policies, the mentorship, satisfying efforts from organization structure to support in nursing needs, values of learner, and clinical practice as well as their own empowerment from the first year to last year of their study. I think it is the same factors that empowered you as students in our hospital, which is related to, for example, continuous support, mentorship, clear nursing policies for you, and the support from the organizational structure or clinical settings that you are training, you're training on it. For example, library, auditory room, training room in the hospital, spaces, all these issues can empower you during the clinical training, or not necessarily clinical, also theoretical course. You need that everything must be clear as policies, procedure, and the references for you as students. While as educator, empowerment should also be raised. For example, results show that the organizational culture was a statistically significant contributor to faculty empowerment. One of the main issues that empower nurses, educator, is the organizational culture involving them in decision making, independency, autonomy. All of these issues are considered as factor enhance educator during their teaching process for their students. Also, this literature or this article showed that the nursing leaders play a significant role in creating positive work environment, self-related performance, and by emphasizing authentic leader, more nurses perceive they have access to workplace empowerment structure. Job satisfaction, lower perception of stress in workplace, personal motivation, self-efficacy, and continuous organizational support are other factors. You can read the rest of this article, it's very important. And here is the matrix of literature review. You can read each article and the main results and findings for each one related to the process of empowering and the factors that increase or decrease the empowerment level among nurses. Okay? Now we will return back to our presentation. Is it clear for you now?
Yes, it is.
Yes. sorry. Mentoring. So we discussed the topic of empowerment, and now we will talk about mentoring process. In mentoring, it includes different strategies. For example, I don't know if the figure is clear for you now. Mentoring includes different tasks. For example,
Yes.
identifying goals. What else?
In the picture, I can say the things in the picture.
Yes, anyone else rather than Aisha?
Training also.
Success.
Training, yes. What else?
Support.
To achieve a goal, exactly.
Identify and achieve goals, exactly.
Motivation.
Successfully. Motivation.
Support.
Support. What else?
Direction.
Direction.
Advice.
Advice, giving advice. Coaching, training, okay, giving feedback. This is the role of mentor during the hospital or during the performance appraisal process. So the first thing in mentoring, the mentor should be the role model. The role model is the ideal person because he is the supervisor and he is the source of teaching for the new nurses, and so he should be the ideal, ethical, and he should perform issues in an effective way. Coaching, training, introduce mentee to organization and profession, advocate for the mentee. The mentor should advocate for everything for the mentee. Okay? During the performance appraisal, we talked previously about the position description and the job description. Anyone can inform me about the job description? What is the characteristics of job description? What includes job description?
Based on
Can I?
philosophy and objective of an organization.
Okay.
Can I
Okay.
answer?
The job description should be based on the
Continue.
philosophy and objective of organization, but itself what includes?
May I
Doctor, can I
answer?
answer?
Yes. Yes, you can.
Go ahead, Aisha. She asked before me.
Okay, Aisha, then Natalie.
Okay. I think the job description may contain the specific job you have to do in the hospital or the organization.
Okay, so it includes responsibilities, duties, requirements
Yes.
for to be implemented during clinical days or during duties. What else? Natalie.
She said almost the same as I wanted to say. I wanted to say the purpose or the main goal of the job. It contained the main goal behind this job.
Okay, and the
thing
job
that I
description
have to
is based.
achieve.
The job description is based on purpose and cause of your occurrence as a job. But while the content of job description is the tasks, responsibilities, duties, requirements from you as employee in the job. Okay, and here they talk about the successful performance. What is the expectation from you as registered nurse, for example, or as practical nurse to perform successfully? What is the successful performance? What are the standards, required standards from you, and the expected performance to be performed during your duties in the hospital? Okay, so we mentioned till now selection process, developing process, and we talk in developing process about empowerment, about mentorship, and we talked also about the orientation program. Now we will mention performance appraisal or performance evaluation. What is the performance appraisal?
Can I?
Yes, please.
Performance appraisal is a way to evaluate the job continue. Is the job working in the right way?
Okay.
I can evaluate the job.
Okay, evaluation, the process of doing job successfully or
Yes.
doing job description successfully. This is the performance appraisal. How you perform the objectives and the purposes that is required from your occurrence during your duties. This is the performance appraisal. The best appraisal is deducted from job description. Okay? The best appraisal is evolved and deducted from the job description. It's a very important point. If I want to supervise or evaluate the registered nurse or any employee, I have to refer to his or her job description. And after looking to job description, I have to check if he performed the tasks, responsibilities, duties that are mentioned in the job description sheets or not, okay? So I have not to ask from registered nurse, for example, to go and to do stitching for my patients. It's one of the error.
Yes.
When you evaluate the performance based on tasks not mentioned in the job description. Also, should be addressed as a system and ongoing process, not at one time only.
Yes.
Okay. During your existence as a hospital, as practical nurses, and I know that some of you are practical nurses in hospital, how many times you are evaluated per year, for example?
On each contract.
Okay, do you think it's one only annually?
Every 3 months.
Every 3 months. Who said every 3 months?
Lena.
Yes, Lena. So they did performance evaluation for you every 3 months, okay?
Yes.
Islam once annually. That's depend on the hospital policy, okay? At least once annually, but even it is conducted once annually, the head nurse or the main supervisor for you, Islam, they have to observe your performance and they have to observe your tasks responsibility in a continuous manner. So it is a systematic manner. Every 3 months, for example, they can do a minor report and the major report, which we call it annually. They may be submit the annual report for performance to the director of nursing. Also, it must be competency-based evaluation. Competency-based evaluation, that indicates the same process that we evaluate you as students during all of our courses. We evaluate you based on competencies of patient safety, for example, competencies of communication, competencies of performing procedure effectively, IV cannula insertion, all of tasks that we did, it is a competencies. These competencies have a checklist and have standards to be performed in the successful and effective way, and the manager of you or the supervisor should look for your evaluation based on these competencies, okay? طيب. Why we need performance appraisal? Here, they mentioned that it is important for administrative decisions. What are the administrative decisions that we can make it based on the performance appraisal? What do you think? You can speak in Arabic.
Make high quality for organization.
Okay, this is the benefit of performance appraisal, is to improve the quality of the organization or the management. But my question is, how we can utilize the performance appraisals for the staff in administrative decisions? What are the administrative decisions that we can take based on the performance appraisal?
Maybe hiring? If I should hire you or not?
Promoting, do you mean?
Yes, the same way.
Promoting, yes. It is for promoting. If I want, for example, if you always your appraisal is above 90 out of 100, and you have excellent achievement, we return back to internal hiring process. If I need head nurse, for example, for the units, may I refer to performance appraisal to hire you. The opposite of hiring is, what is the opposite of hiring? The opposite of promotion? Terminating. Termination. Termination is the process of not continue the new contract with the employee because their performance appraisal. اللي هي بالعربي خليني احكي لكم اياها، اللي هي انك انت بتنهي شغل الممرضين. اوكي شباب، بدي مشاركه من الكل اذا سمحتوا. عادي لو شاركتوا في العربي، يعني it is a lecture and وهمي انا انكم تحققوا الاوبجكتيفز تبعت الليكتشر. اوكي So, used as basis for administrative decisions. For example, from these decisions, we have termination, a promotion, recognition. May I increase the salary of employee or the salary of nurses based on the performance appraisal? And the recognition could be different based on a performance appraisal. For example, the excellence employee, we will increase 40 GDs per year. The poor or satisfactory employee 20 GDs. So it depends on the administrative decisions depend on the performance appraisal. Okay.
Just a turnover.
Administrative decisions, yes, it could reduce the turnover rate because for example, we do recognition, we do promotion based on the performance appraisal. Now we will discuss different types of performance appraisal tool, for example, personal, peer, managerial appraisal components. It includes two things. It could be informal or formal. Informal appraisal, like comments, when I say thanks, okay, thank you, comments, or you are excellent. These comments are considered as informal performance appraisal. Thanks letter.
Yes.
When we received, for example, thanks letter for the distinguished employee. Customer letters and comments. Many times we note nurses who are graduated from our university. Some patients, for example, thanks them and give them a letter in a newspaper, and they post those thanks letter on their Facebook. Already, even that these issues are not financially, but also it is considered as a recognition and rewards for employees during their work appreciation. Okay. Also, from the tool of performance appraisal, we have what we call formal. Formal means predetermined evaluation tools. Employee must understand the time and content and the scoring. It's very important in formal appraisal. Me as employee, I have to identify well when I will be evaluated and what is the criteria. Like you as a student, we have what we call rubric for assignments. In rubric, you understand well what are the items and the criteria that you will be evaluated on during applying this assignment. Also, as employee in the hospital, the criteria of evaluation as a hospital, competency-based evaluation should be announced to the nurse and the employee, and they have to know the content of scoring. Why? Because the content of scoring, it could be legally defendable. Sometime in case of termination, while the performance appraisal is excellent, the employee can refer to the court to obtain his right or her right. Okay, could be anecdotal notes or subjective notes. It could be considered like something narrative notes for the employee, and could be competency checklist as what we have in our university. And also in Jordan, we have Jordanian Nursing Council checklist or Jordanian Nursing Council competency checklist for registered nurses who are working in hospital, and they are evaluated based on these checklists. Okay. Characteristics of an effective performance appraisal. system. What are the characteristics? Who can discuss or interact, please?
Administrative supporting person.
Administrative support present. Present. Here in this point, the administrative decision should be based on performance appraisal. If not, that indicates that there is no meaning for the performance appraisal. So we have to consider the performance appraisal, and we have to take the support from administrative and commitment from administrative managers to show the importance of performance appraisal. What else?
Doctor?
Yes?
We can say clear plan or criteria.
Clear plan or clear criteria for evaluation. Thank you, Natalie. What else?
Evaluation related to job description.
Yes, thank you. Evaluation related to job description. And we discussed this point before. What else?
Clear criteria for evaluation also?
Yes, as mentioned by Natalie.
Evaluators identified to employees.
Yeah, thank you, Lena. Evaluators identified to employees. It is very important that the person who will evaluate you will be oriented for you. For example, I am registered nurse in medical surgical. The evaluator for me is the head nurse. I have to know that the evaluator for performance appraisal for me is the head nurse. So you have to know the person who will evaluate you, okay? Okay. We have
and the procedure also.
Okay, as in our university, teachers who will evaluate you as a teacher, and for example, the clinical instructor who is with you during the clinical area, he is responsible or she is responsible to evaluate you as students. Performance appraisal 2, the tools. The tool should facilitate accurate appraisal of the individual performance and provide an opportunity to identify personal goals of individuals and goals of organization. Data, when we collect data via tool, يعني we have tool or checklist. This tool should be reflect the job description and the competencies. Collecting process or collecting data for performance appraisal have characteristics. These characteristics, we say that data should be accurate and representative of person work. That's what we call valid data. Valid data indicate the accuracy level and the representative of person work. So I have to observe you well to give valid and accurate data that reflects your performance. Collect behavioral information. So not only to observe the person, what he said, for example, or exams, I have to check the behavior for the individual, how he contact or how he communicate with his colleague, how he communicate with patients, how he communicate with patients' relative. Document review, especially for those who work evening shift. Also, this is very important issue. We have, as we measure this, please, can you mute the microphone? Thank you. Document review, especially for those who work evening. As we observe the person in day shift, we have also observed the nurses in night shift or in evening shift. We have to protect against positive and negative personnel bias. For example, if I hate some characteristics for a person, these emotions should not be reflected on my evaluation or my feedback for this person, okay? Or if I have personal conflict with some nurses, this should not be reflected on the performance appraisal and performance evaluation. We have tool. These tools could be structural tool or flexible tool. Both of them are important to show a perfect or successful performance appraisal. So it's very important to combine or to merge the structured tool evaluation with the flexible tools evaluation. In a structural tool evaluation, we have two tools, force distribution scale and the graphic rating scale. Who can tell me about the force distribution scale? As we see here, can you see the figure?
Norm reference tool.
It is a norm
Reference tool.
Okay, so we have norm, we have a schematic diagram, and we can put each employee in an area that he can see his performance in comparison to other. Okay, it's very important to see here how we can observe the norms or the achievement based on non-performance, top performance, or average performance. Okay, so this scale reflects the process of how we can discriminate between employee achievement and employee as a schematic diagram. In this schematic diagram, each person can know the location of him or herself in comparison to others people who are working with him. And that's yes.
And this will empower them also to achieve
Yes.
more, work more.
This will empower them, and this will increase the competition among the employee and among the nurses.
Exactly.
Yes, among the employee and among the nurses. Okay. Okay. We have the second tool or the second scale, we call it a graphic rating scale. And this is the most simplest and the most famous scale used in clinical setting, and also in our university. I think you are oriented about these scales.
Yes.
When you have, for example, here competency, and each competency is ranked from 1 to 5 scale, from poor to excellent. And by the end of that, there is a numeric rating. You take your grades out of 100, and you know, for example, if you are above 80, you are above 90, you are excellent. Above 80, you are very good. Above 70, you are good. Above 60, and this rank reflects your achievement as a numeric way. And this is the most common tool or scale used in clinical setting. For example, here, excellent, good, fair, and poor judgment. Okay. We have, as we mentioned, we have tools and we have observation process for our employee, but we have also errors that we have to take it in consideration during the process of evaluation. From these errors, we have something we call it halo effect error. Anyone can inform me about this type of error?
Yes, Doctor, can I?
Yes, please.
Okay. Here, for example, the monitor may, if he judge or evaluate a person, and this person have two good positive things, these two positive things will affecting his evaluation.
Yes, excellent, excellent. When I see you, Aisha, for example, you are excellent during performing management course. I go to all my instructors and to all my colleagues and inform them that Aisha is distinguished students in 2 courses, and that's where reflect the judgment and appraisal for other courses.
Yes,
so
exactly.
I observe you in 2 courses or on 2 tasks, in 2 competences, but my evaluation was for all and comprehensive assessment. This is why we call it halo effect error. Okay, we also another type of error, horn effect error.
Yes. Can I give you another example for it?
Yes, please.
In this type, the opposite way,
yes.
If you want to evaluate a person and he have like 2 negative things, these 2 negative things will affecting your evaluating process.
Yeah, thank you, Aisha. So halo effect error, if you have positive things, while horn effect error, If you have negative things, I will be harsh and I will be very hard with you, and I give you negative evaluation based on 2 tasks that I assessed you before negatively. Okay, we have central tendency. Central tendency means usually I am afraid to give you a high grade or very low grade. So the location of evaluation process will be on average, for all employee on average. For example, I give all students 6 out of 10 or 7 out of 10 because I am afraid to give you 10 full mark or to give you fail grades as 3 or 2. Okay? Prompt recency effect. From its name, recency effect. What is the meaning of recency effect? Recency, the most recency effect. Recent evaluation.
Closer to rating.
Yeah, the last.
Yes,
The last thing.
it is closer to the rating session. For example, as Lena or Islam said that they have once annually as evaluation performance. I am as a head nurse, I will look for you and your performance after before 2 months only, and I leave all the rest of months during the year. And this will affect your performance appraisal because I just take a short duration to observe your performance during this period of time. These are the structure. So the structure tool, we mentioned force distribution scale and graphic rating scales, and we mentioned the most common errors for these tools. We have flexible tools. Inflexible tool or inflexible tools, we have what we call management by objective, behavior and rating scales, and peer review. Management by objective, from its name, management by objectives. Objectives for whom?
For, can I?
Lena, can you answer, Lena, please?
Objectives for organization, maybe.
Yes, excellent. Objectives for the hospital or for organization, and the objectives for the employee himself or herself. So the objectives mutually agreed by employee and the manager. So we have objectives by me as employee, and there are objectives from the organization. The consistency, agreement, congruency between the objectives from both sides, employee and manager, are very important to be mutually agreed by both of parties. And how long the employee or the personnel achieve the objectives of organization will be positively evaluated, and how long the employee is away and he did not perform the objectives successfully of the organization, he will be negatively appraised. Okay, we have here behavioral anchored rating scale, PARS. This is an example of PARS or behavioral. From its name, behavioral, that means your supervisor or your manager will observe your behavior as a nurse. Behaviors indicate standards, practice, competencies, and how you behave toward these practice or these standards. For example, the way of communication with doctor, how you interact with physician, from
and
1
infection control
to 5. How you perform infection control, from 1 to 5. By mention like
Communicate with patient.
By mention like narrative statement. And this narrative statement is evaluated and rated from 1 to 5. That reflects the compliance of you with these standards. It could be described quantitatively and qualitatively. As you see here, we have a quantitative, number, numeric, and qualitative. And qualitative is a description of your behavior as a nurse. How, for example, fails to follow the doctor's order or to doctor request or to apply a doctor request. Often impatient with difficult patients. خليني هون to read. Always follows doctor's orders, occasionally Inpatients with difficult patients rarely doesn't follow hospital procedure. So هون بياخد 2. 5 always follows doctor's orders, available to meet with doctors whenever needed, never impatient with difficult patients, helps other nurses with difficult patients, always follow hospital procedure. So he performed excellent and he obtained rank 5. Okay, so flexible measure, management by objective, behavioral anchored scale, and peer review. Who can inform me how we can do peer review? Peer review. What is the meaning of peer review? Those are the peer. For example, this is the nurse, this is the nurse, and
Yes.
those are the peers.
Yes.
Yes. What I will ask from the peer to do.
Can I answer?
Yes, please.
Evaluate. I will ask the peers to evaluate.
Yes, based on
their peers.
Based
Yes,
on
based on specific
competences
criteria.
or specific criteria, I have to ask from the colleague, especially something related to communication, team building, the spirit, the way of communication, with the way of interaction with others, the way of conflict management. May I refer to peer review? Yes, please.
Peer review, I can use it oftenly in communication and how you speak with your doctor, but not in the procedures. And I cannot let the peer evaluate your procedures because they don't have the enough knowledge, right?
Yes, yes, it is one of things that we talked during our lecture in delegation. Excellent, Aisha. When we mentioned that one of tasks that not to be delegated is a performance appraisal because it needs a high management skills. But here we can ask the peer to review your action, for example, about the cannula insertion. But I will not take it alone as a final decision making during two administrative issues. I have to compare the findings from peer review with other related methods or tools. So in one hospital or in one unit, we can use different tools of evaluation. Why? What is the reason to do different tool of evaluation for the same period and for the same duration for the same person? Why? What do you think?
To collect more information and more accurate one?
More accurate and valid information. So I build my decision based on different criteria. This is, for example, we can do self-evaluation, we can do peer evaluation, we can do manager evaluation. The manager evaluation could be for qualitative, quantitative, behavioral, structural tool, non-structural tool. And when all of these issues recommend that Aisha is distinguished student, for example, that will give me more accurate and more valid answer to take a decision related to something. Okay? Is that clear?
Okay, yes, it's very clear.
If there are any question, please ask me. Or you can write on chat. I will read all of your chat message and I will answer you later, okay?
Okay.
Now we will talk about providing feedback, negative feedback and positive feedback. Positive feedback. The positive feedback is to say that there's good thing
you did
is
excellent
for
job.
The employee. Excellent job, yes. Feedback, communication to others, what they have done correctly and well, how they perform things well and in a correct way. The guideline of positive feedback, those are the guideline for both positive, negative, but there's something in opposite. Here, we say that it occurs timely on the spot. If I see the nurse, he performed something, he performed a good thing, I have to inform him that you are excellent, okay? And occur frequently in a continuous, systematic manner. Then it should be accurate, valid, without any error, as we mentioned in previous slide, the types of error. I have to avoid them.
And Doctor,
yes.
And it should be accurate so others can learn from it.
Yeah, sure, yes. And sincere objective, it should be objective, not subjective, not for personal judgment, not for example, because I like you, Natalie, I have to give you a high grade, for example, or I have you a positive evaluation, could be given in public. And this is the main important issue. When you give positive feedback for some person or for employee or for students, you have to inform him about his achievement in front of all, not in private, okay? While negative feedback is the feedback that you give for the person when he did something wrong, or when
the opposite guidelines.
The opposite. It is not the opposite guideline. Take care. For example, both of them, the positive and negative, should be occur timely and frequently. Okay?
Yes.
It should be occur timely, it should be occur frequently, and it should be accurate, should be objective. The same criteria for positive evaluation. However, based on observable behavior rather than personality trait, it is the same for both positive and negative feedback. It includes suggestions for alternative behavior. Here is very important issue. If I know that you have mistake or you perform something wrong in a not correct manner, I have to tell you what are the suggestions to improve your mistake, okay? Without blaming, please, without blaming. Don't blame others about their mistakes. It is considered as opportunity for improvement. No threatening or blaming, this is my point, and should be given in private, in opposite to the positive feedback. The positive feedback should be given in public, while the negative feedback should be given in private, okay?
Yeah.
In conclusion, anyone can conclude what we discussed today in our lecture?
Can I?
Yes, please.
We speak about how can we evaluate the job performance.
Okay.
Continue or let someone else answer?
Lina, can you continue about what we discussed today in our lecture?
We
Doctor.
said
Lina,
the standard. We said the standards of evaluation.
And types of evaluation, yes. Natalie, can you answer? Can you continue?
Yes, and the tools we used while evaluation someone and the sites we depend on for evaluation. And in addition to this, we can say how the way of our evaluation for a person can affect the person negatively and positively.
Okay.
And the feedback on it, and we can what we can build on the evaluation.
So yes, what are the decision making or the administrative decision we can make it based on our evaluation. So previously we can, in summary, we can mention that in our lecture today we define the job performance, job description, job or position description. We also identify the tools that we can use in performance appraisal, the importance, the benefits of performance appraisal, and the types of structural and flexible and inflexible tools of evaluation, the types of errors that could be occurred during a clinical application performance appraisal, and by the end we discussed what we discussed. Yes,
negative
and positive feedback during giving feedback to employee, even positively or negatively. In next lecture, after tomorrow, we will continue for this lecture by doing an application session The application session will include, for example, scenarios, clinical cases, and examples from real setting from hospital about performance appraisal checklist tool. So anyone can bring. I asked you from previous week, but I did not receive from anyone till now the tool or checklist that you are evaluated and during your hospital work. Okay, so we will do application session after tomorrow inshallah. Okay, any question?
Okay.
No, thank you.
No, doctor.
Thank you,
يعطيك العافية.
doctor.
الله يعافيك يا هلا.
يعطيك العافية دكتورة.
الله
كان
يعافيك.